Buenas and Hofade, everyone. The public hearing of the Committee on Health and Veterans Affairs is now in session. The time is now 2 o'clock. It is Wednesday, February 17th, 2026. We appreciate everyone who's joined us this afternoon. The committee is meeting today to receive testimony concerning the appointment of Dr. Ricardo Eusebio by Governor Lulian Guerrero to serve on the Guam Board of Medical Examiners as the Guam Memorial Hospital Authority's Medical Director Representative. Reading through all the supporting documents, it's clear that Dr. Eusebio brings deep clinical credibility, institutional knowledge, and leadership experience that align with the responsibilities of the Guam Board of Medical Examiners. The confirmation hearing is less about whether he is qualified, he clearly is, and more about how he intends to use that experience to address long-standing systemic concerns around licensure, oversight, transparency, and public trust. All required notice for this hearing was issued in accordance with the open government law and provided to senators, stakeholders, and members of the media. Notice was also posted on the Guam Legislature's website and the public notice portal. Written materials related to today's agenda have been made available through the committee drive and are also available in hard copy upon request. Today's proceedings will be recorded and made accessible through the Guam Legislature Media YouTube channel. At this time, I would like to acknowledge members of the legislature who are present with us today. Thank you for joining us, Senator Tello Taitagui. And you're already signed up and here to testify, so if you could, we'll start accepting public testimony, beginning with you, Brianna.
Thank you. Brianna Sublime, the Acting Administrator out of the Health Professional Licensing Office, Department of Public Health and Social Services. I read to the record on behalf of Director Areola. Hafade, Senator Salas, Matanane, and esteemed senators of the 38th Guam Legislature, thank you for the opportunity to provide testimony on the appointment of Dr. Ricardo B. Eusebio to the Guam Board of Medical Examiners. On behalf of the Department of Public Health and Social Services and its Health Professional Licensing Office, we fully support his appointment. Dr. Eusebio is a highly qualified, board-certified general surgeon with over 30 years of medical experience, a graduate of George Washington University School of Medicine and a fellow of the American College of Surgeons. He brings extensive clinical and surgical expertise to this role. Throughout his career, Dr. Eusebio has served Guam's healthcare community with both clinical excellence and administrative leadership. As a co-founder of Island Surgical Center and current medical director at Guam Memorial Hospital Authority, he has spent decades of providing high-quality care while navigating complex medical regulations. His proactive work addressing the island's physician shortage through pathways for international medical graduates show his commitment to expanding access to care for our community. Dr. Eusebio is a pillar of Guam's medical community whose decades of service reflect a deep dedication to the people of our island. His appointment will bring an essential perspective to the board, one that upholds rigorous professional standards while understanding our local healthcare challenges. By confirming Dr. Eusebio, the legislature will ensure the board is guided by a leader of proven integrity and expertise. We urge your favorable consideration of his nomination to help safeguard the health and well-being of all Guam residents. Sizos Maasi for your leadership and consideration. Teresa C. Areola. Thank you.
Thank you, Ms. Sablon. Dr. Eusebio.
Thank you very much for inviting me in, having the opportunity to submit my nomination in this for this position. I appreciate this, Chairwoman, Senator Matanane, other Senator Taitagui. I appreciate this opportunity to speak. I am a person who has been here for many years. I was born in the Philippines and grew up here in Guam. Went to school at Sinanya Elementary School, Bishop Baumgartner School, and then eventually graduated for Father Duenas. I left here in '72 and attended Creighton University, and then subsequently went to George Washington University Medical School through a professional health and technical scholarship. I trained in surgery and spent some time in the Navy before coming back home to Guam. My goal was always to return to Guam, and tailored my training to make sure that I'll be able to come back and provide the care that Guam needs. Throughout my experience here, I've assisted in many duties and administrative positions in Guam Memorial Hospital, as well as having been chairman of the licensure board in the past. I appreciate the opportunity to serve again, and would be pleased to be approved in this nomination. Thank you.
Thank you, Dr. Eusebio. We will now have some questions that I have, just a few, and then Senator Tydekwe.
Sure.
There have been several concerns, and it was also brought up during the confirmation hearing for Dr. Annie Berdalio regarding whether the GBME acts swiftly and transparently when complaints are filed. What is your view on how the Guam Board of Medical Examiners can strengthen public trust while also respecting due process for physicians?
The procedures in which physicians are disciplined nowadays perhaps is a little bit more different than when I was here last. I think there's more transparency now. There is also a desire to make sure that the physicians that are licensed are adequately trained and behave appropriately, and ensure that the public is being served. How this is performed, I think the licensure board, as I stated, has been a little bit different because before there's not as much public scrutiny, I felt, as compared to now. Because of this public scrutiny, I think that the board has been acting more swiftly and more transparent to the public, and also to the governor and the legislature. So I think that the trend, at least in terms of how the licensure board performs, has been positive for the public. And I think that most of the criticisms that people have towards the licensure board is more or less related to misinformation and perhaps miscommunication. And that is something that the licensure board can perhaps do better. And so I think that the role of the licensure board in terms of ensuring that physicians are safe in Guam, that they practice with care, and that they perform the services that people of Guam need, has been and continue to be, serving the public with trust and good.
You said misinformation and miscommunication. What exactly do you mean by that?
Okay.
Because you do see people that come out, it's in the media, and there are, like for example, Mr. David Lubofsky, he's been demanding action from the Guam Board of Medical Examiners for years for the death of his son. And how do you respond to that?
There's always, anytime one loses a family member, there's always a significant emotional impact in that, which may impair how one perceives things. And so I think that in this particular situation, I am not privy to all the details from the licensure board performance or information. I am acting or speaking now based on what I've read in the newspaper and the media, what I've heard from what people say. So I don't have the objective data to make any comments or conclusions on Mr. Lebowski's case. However, I appreciate the loss that he's had in terms of the loss of his family member, and understand that many times because of those losses, we have certain feelings in regards to how a family member would have been treated, or how things could have been changed should something have happened. Part of the reason why I went into medicine is because of my own history in regards to something very similar. My youngest brother, when I was growing up, had a cancer that I felt was, as a sixth grader, felt that he was mistreated. And because of my own misinformation and my own, perhaps at that time, a lack of maturity, I thought that he should have been better treated. But the incentive was for me, as a kid growing up, that provoked me to have this desire to be a physician. And many times there are instances in our lives where we don't completely understand why this happened, but there's a greater plan somehow.
Sorry, go ahead. Yep.
It's okay. So at least that, in terms of that situation, I think I can understand how he would feel that way. But I think that his case has been looked and evaluated by the licensure board, other physicians, and both legally, I believe, in terms of a lawsuit. I think that those things are better left for me not to comment on, because I don't know what the details are. But I appreciate his sufferings.
What do you think the Guam legislature can do, or what do you suggest the Guam legislature do to help move the Guam Board of Medical Examiners issues forward? Because we can go back to the media. We see all of the stories about the delays and the issues with licensure. From a policy perspective, what can we do to help GBME?
One of the reasons why I decided to accept the role as medical director again is because of the fact that I feel very strongly about the foreign medical licensure bill, and I truly feel that this is going to help the people of Guam. We've always struggled with not having enough physicians to take care, both in primary care and specialty care. And part of that reason is because of the fact that we are geographically in a not ideal place that physicians want to be in. And so I've always felt that it didn't make any sense that somebody would want to fly to the Philippines and have their care there, and whatever is done to them medically or surgically is acceptable to the people of Guam, But then when that physician comes here, it's totally inadequate. That just doesn't make, that never made any sense to me. I understand that the training that they have in the Philippines and also that we have in the United States are different in some respects. However, we need to be able to say that this physician is safe. This physician can be here in Guam and deliver care to the people of Guam so that people don't have to go to the Philippines, people don't have to go elsewhere in order to be able to obtain safe and adequate care. And I think that the legislature can help us support that bill so that we can have this foreign medical licensure law. The sooner we get it, the better it is.
Well, I'm glad you actually brought that up, and I'm sure that Senator Tydek, might have some questions related to that, because we did just have the public hearing on her foreign licensure bill related to the J1 Conrad Physicians Waiver Program. And so, as I understand, you might have been or were involved in the discussions regarding the governor's version of a foreign licensure bill. Can you tell us a little bit about the differences between the two?
There were some differences. One is relating to the number of years that someone is placed under observation. And then another one is the fact that someone who has this license will be able to practice normally, just like someone who did not apply for this license. And when we had our meeting with the FSMB, Federal Licensure, when we had our meeting with them, they emphasized that it's important that physicians are treated equally. In other words, we can't have two different levels of licenses, one in which we have a U.S. level and the other one in which we have the foreign level. That one is inferior to the other, and then the public can look at this as one physician being more inferior to the other. And so they're very sensitive to that. And I think that that was seen in the different the governor's version and the other version, the legislature's version. So I can't, I would have to look at it specifically, but those are the things that strike me right now in terms of the differences between the two.
Do you know when that bill will be finished and sent to the legislature?
I was just reading the version that Dr. Berg sent me, and hopefully we can agree upon the language that he has. The recommendation that the Federation had for us is that we not reinvent the law, but there's already laws out there that are similar. But we need to look at it, and what they recommend is that we look at the Massachusetts law. And the Massachusetts law is perhaps best tailored to Guam. And we can even tailor it ourselves. So I haven't completely looked at Dr. Berg's recommendation, but I will look at it because I truly want to accomplish this thing, this bill, this law, because I think that it's going to make a difference in terms of how we can deliver care to the people of Guam. Certainly from the point of view of GMH, It allows us to be able to hire physicians from the Philippines, because Philippines, Japan, Taiwan, whatever, but we can be competitive in terms of allowing those people to come here, because the salaries that we can provide them would be much better than where they're from. And so there's some incentive to that. And also to be able to see how medicine is practiced here in the United States. That's also an added incentive. So I think this is something that many years ago, the reason why this is sort of like close to my heart, is that many years ago when I was chairman of the licensure board, I wanted to do this, but the environment was such that I couldn't. And there were many people opposed to it. But now, there are many people who feel that this is the right time, that now is the time to be able to do this. And I think, and I totally agree, that we need to, really pursue this at this time.
Thank you, Dr. Eusebio. Senator Taitigui.
Thank you. Thank you, Madam Chair, and good afternoon, Doctor, of course, and good afternoon to, I'm sorry, can you get your name, please, again?
Brianna.
Brianna, that's it, Brianna. Hi, and Brianna, you're with Public Health, correct?
That's correct.
Are you in the board, do you oversee the Board of Medical Examiners? Is that your position there?
Yes, in the licensing office.
The license, yeah.
Yes.
If I recall, you were here too when we had the bill that was coming, yes?
Yes.
Okay, great. Good to see you.
Great to see you too. Thank you.
So the bill that Senator Sabine was talking about regarding the bill that I introduced regarding the J1 Conrad, there's a lot of people not really understanding this bill, and it's very simple. We are not creating a program. It's already been created. It's the J1, visa waiver that some people have taken advantage of here, right? And then the Conrad 30 adds that flair where instead of having to go back to where they came from and work there, they can actually stay on Guam as long as they're in an area that's underserved. And we all know that the whole island is underserved. So that's the meat of it, but the part that's very important is to allow the Board of Medical Examiners to acknowledge the certain graduates. We're codifying certain definitions so that the Board of Medical Examiners can understand what or know that this is a qualification of an individual, that it's recognized as a graduate. So it's as simple as that. However, I did, Dr. Eusebio, because you and I talked about this actually during a committee of the whole when you were at the legislature on foreign doctors months and months ago. And it was through that conversation that now is the time. You're absolutely right. Now is the time. Because even though I tried to do this prior to this term, and was going down that road, I was met with a lot of oppositions, just like the medical malpractice arbitration bill. But as we are seeing the world have a shortage of doctors, nurses, medical workers, it's just enormous now. Everybody's competing for the same pool. And that's a pool that is, a lot of them have retired. And it's very difficult to get any of these medical individuals here, right? So yeah, sooner than later. And that's why I'm just surprised that, I tried to reach out to everybody that was working when I found out the governor was working on a bill, to join the bill that I already introduced, and let's add those parts to the bill to make it better. And because, like I said, sooner than later to get this bill out. But they were waiting for the FSMB. And this is a nonprofit organization, if I'm not mistaken. It's a group that oversees a pool of physicians and medical workers. And there is like a fee, if I'm not mistaken, a fee that's required to be a member. And I believe Dr. Berg was trying to be a member, have Guam be a member of the FSMB. Now, I don't know who's going to pay the membership dues or what, or how we're going to get this through, but their being here was helpful, would have been helpful for all of us, the oversight chair as well as myself, to talk about some of the things to be included. We looked at other laws, like you said, the one in Massachusetts. We also looked at one in New Jersey, if I'm not mistaken, and we're seeing a lot more bills coming out from states, and of course, CNMI just passed theirs. They have one very similar, but they're making the Board of Medical Examiners decide on who they're allowing in. But that's, they're a Commonwealth of Northern Marianas. They have more leverage than we do. We still follow federal guidelines, visas. And that's something that we cannot step on. The federal government are the ones who are the caretakers for visas. So we rely on them to allow us to have that. And so that's what we were looking at, the J1, at least we can move forward. But anywho, I'm sure you had a chance to see it and would appreciate your testimony on that bill if you have a chance to look at it, because if there's anybody that was inspiring to me in writing that bill, it was you. So I greatly appreciate your enthusiasm and the push on that. But this is your first term as a Board of Medical Examiners?
Yes.
First term as a member. Okay, so you're going to see quite a bit of things that I hope you will share with this body, that what we can do to make that Board of Medical Examiners better and more respected, because right now it is covered with a black cloud above it, with so many complaints, and nothing has come about these complaints. They're almost falling on deaf ears. Also, if you can continue to look at the website, because that's very important. Transparency has always been a key for me. So the website, if you can look into that. And my question too is, physician, how are you going to be objective toward your peers when you do have complaints coming your way?
Being objective is always a problem. I would be lying to you if I said that was not a problem. That's why it's important to have certain criteria, and then also not having one person make a decision and have a group of people make a decision. I believe that the board is not only made up of only physicians, but also other people that can provide objective data in regards to that. But again, I'm not going to say it's easy to make those decisions. Anytime you're involved in anything that involves moral issues, especially one in which we always are worried about if something can happen to one person, the same thing can happen to you. And so you're always worried about how you're going to perceive this should it happen to you. And that always tailors how you make your decisions. All of what we do as physicians has really one overriding factor, and that is ethically, how do you feel that you should be able to practice safely so that the patient is going to be able to receive appropriate care. That is always the overriding factor in any of the decisions that we make as a licensure board, as a physician, as a member of the administrative staff at GMH. It's how do we deliver safe care to this person and make sure that what we're doing is going to be what is the appropriate level of care for the patient. Not only safe care, but appropriate level of care. Because sometimes we're not able to deliver the safe care that we need because the patient requires a higher specialty that we cannot provide. And so in order to provide the safe care, the safe, appropriate care, we need to transfer the patient off island. But those are the things that we need to be able to decide. Those things that as a physician, as a member of the licensure board, as a member of the administrative staff at GMH, those are things that we need to be able to decide ethically and morally.
Thank you. Also, do you have a private practice other than, being at Guam Memorial Hospital? Do you still have your private practice?
Guam Memorial Hospital has the physicians that are employed at Guam Memorial Hospital are basically within the Government Malpractice Act. I can't remember exactly what's the name, but if you're employed by GMH, then you're covered by the government in that respect. There is no requirement at GMH that says that in order to be able to practice there, that you have to have malpractice insurance. It's recommended, but it is not required. And I'll tell you why that is. Because premiums for malpractice insurance are extremely high, and it limits our ability to be able to practice in Guam in a way that many in the United States, the malpractice premiums are high, yes, but not as high as they are in Guam. In Guam, it's totally ridiculous. So that a lot of physicians, in order to be able to practice in Guam, practice bare, if I may say, without malpractice insurance. And it is something that would be nice if we had a means whereby we can provide physicians that malpractice insurance. If you are employed at GRMC, for example, they provide the malpractice insurance for you. If you're employed at Seventh-day Adventist, they provide the malpractice insurance for you. But if you are in private practice, you're on your own.
Yeah, and FHP provides that as well. There's a conflict of interest is what I'm getting to. And in the event that there is a conflict of interest, you have no problem stepping aside from that conflict. For instance, if you had a fellow doctor or physician who you've been working with or share things with, who is up for disciplinary or have been somebody filed a complaint, will you step down from that hearing?
I'm sorry?
In the event you have a conflict like a former partner that you worked with, things like that, would you, as a conflict of interest, you have no problem stepping aside if there's a conflict?
If there's an issue that I feel that I have a conflict of interest in, there's no question I'll step aside. Okay. And I'll be the first to let the board members know that I have a conflict of interest.
Okay. And then again, the FSMB that you talked about, is there a membership dues that's required to be a part of this group? Maybe public health can answer that.
No, there's not really.
I think she can give that answer. Go ahead.
Senator Taiubi, $2,400 is the annual dues that we pay for the Federation of State Medical Boards.
Okay. To be a member of the FSMB?
Correct.
Okay, thank you.
You're welcome.
Okay, other than that, thank you so much, Dr. Eusebio. I had the pleasure of also meeting your daughter in my office, Marissa. She's excellent. She's She's gotten into IT, cybersecurity, and digital format, which I oversee on technology. And she's been a gem coming to my office, and we have good conversation. And she's looking forward to the AI task force that's coming up that she can provide. So you have a beautiful daughter there, a very smart, very respectful girl. So you did good there for sure. If that's a reflection on you as an individual. You have a great daughter there, so please give her my best. Other than that, I look forward to seeing your performance as a board member on the Board of Medical Examiners and see how well you do there, because we need to take that black cloud away from this, and I hope you can bring that. Okay, clear the clouds. Clear the clouds. Okay, thank you.
Thank you, Senator Tidegway, and tell Marissa I said hello as well. Again, thank you for your willingness to serve and for accepting this important appointment. We will complete the committee report and get this onto the March session agenda. And aside from just thank you for accepting this appointment, thank you also for your work that you're doing at the Guam Memorial Hospital and the team over there. I know that you guys just signed that agreement with the Hawaii Pacific University Physicians Assistance Program, and as well as the launch of Project Heart. So that concludes today's confirmation hearing. The time is now 2:36. The public hearing of the Committee on Health and Veterans Affairs is hereby adjourned. Sizo Smasi.
Thank you.